Indiana in the Morning, presented by First Commonwealth Bank, here on the Voice of Indiana County, WCCS 101.1 FM and AM 1160. Our time is 9:47, and our interview right now presented by Marcus & Mack, a law firm representing injured people. Sleep, it's been called one of the most important parts of just about every day. People need their rest, and we know that a lot of people probably aren't getting the amount of sleep that they should, especially retirees, according to one report. Joining us right now is sleep specialist Dr. Hal Stewart. Dr. Stewart, thank you very much for taking time out of your busy schedule today. It did sound a little busy whenever we called in.
It's my pleasure. It's always can make time to spread the word about how important sleep is. So thank you for letting me have the opportunity.
All right. So, Dr. Stewart, let's start off with the topic at hand. Retirees not getting enough sleep at night. Is it just because people are having a hard time getting to sleep, just switching off their brains at the end of the night? Or what do you think is the main cause of this whole thing?
Well, I think it's I don't want to say twofold. It's a multifactorial issue. Mm-hmm. Recently retired people tend to, they're still used to a regular schedule. And so they haven't developed a new routine. And human beings are creatures of habit, creatures of routine, and we need to have a routine sleep hygiene, if you will. So let's say you've been working the same job for 30 years, and you start at 8, you get off at 4, you got your routine down. Now that stops, you tend to stay up later, and that's one reason. Another reason is, retirees are older than the average population, and they're unfortunately, the more aged our society becomes, mm-hmm. the more people are on medications, and many of the medications, they're vital medications that some people need, but they have side effects, and one of them, or a combination of the medication side effects, can be altered sleep, mm-hmm. and that's a big concern because you're not getting the correct sleep, so your immune system is not as strong as it should be, and your body doesn't heal and repair. Right. And it's the very medications that are, supposedly helping you that are causing you to be compromised. So it's a big problem. I would like to see more physicians get their patients off of medications and let the body heal like it's supposed to, mm-hmm. on its own.
How much of this also would be attributed to, say, something like sleep apnea? Well,
that's the third factor there. If you have an obstruction in your airway, and that can be due to small jaws, it can be due to being overweight, just an anatomical obstruction that causes you to snore or have sleep apnea, that is probably one of the most common causes of poor sleep, is actual physical obstruction. So you come out of your normal sleep cycle when you can't breathe, mm-hmm. and the oxygen desaturation levels go way down, the heart rate goes up, carbon dioxide builds up in the body, wakes the brain up. The brain says, "Oh, wake up! Someone's choking. We gotta save them." And you may not actually wake up, but you wake up out of your sleep cycle,
right?
So you don't get that rest,
right? So you would either wake up or you come into like maybe a lighter stage of sleep where it's not as beneficial,
right?
Okay.
Exactly.
So this survey that we've been reading about, a 2015 paper citing about 65%, 2 out of 3 older adults reporting at least one sleep-related problem a night. Is this a trend that has just been growing over the last few years?
I would say no. I would say this is probably, we're more enlightened to it now.
Oh, okay.
But I remember in high school, my girlfriend, her mother she didn't go to bed until about 3:30 in the morning. She couldn't sleep. I mean, this has been a problem, that's been plaguing modern society for years. But we know much more now than we did 10 years ago, even 5 years ago, about the effects of lack of sleep or poor sleep and what it has on the body.
Mm-hmm. Let's talk about some of those effects. The obvious one is kind of the foggy-headed feeling that somebody would feel when they've gone without sleep for a while. But mm-hmm. this can also break down to other areas of the body.
Oh yeah. I mean, people that when you're not getting your sleep, you have less control of your emotions. You have less control of making sound logical decisions. Just because your brain it's working overtime and it's not functioning the way that it's supposed to be. And there are, physiologically, if you do have an obstructive sleep apnea, if you have a sleep disorder breathing, OSA or obstructive sleep apnea, primarily, you are at higher risk of heart disease, diabetes, hypertension. And so these sleep disorders should be addressed, diagnosed, and we can treat them very easily. It's just that a lot of people don't pursue it. But we're seeing an explosion in people since COVID that are looking for answers to, build their immune system so they can be naturally more immune to these viruses and bacteria that are floating around, and sleep is the best, that's the best place to start. That's where your body's immune system builds itself up.
Mm-hmm. We're talking with Dr. Hal Stewart, a sleep specialist, a wake-up call for retirees who may not be getting the sleep that they need to be healthy and happy individuals. I guess, Dr. Stewart, you being a sleep specialist and there being thousands of sleep specialists in this great nation of ours now, I guess people just kind of need to get themselves over to people like you to try to get diagnosed when something like this shows up.
Yeah, it actually is very easy to do now. You don't have to, there are indications where you would need to go to a sleep lab and stay there all night and have, 45 electrodes hooked up to your body. But the home sleep tests are so good now. We use one called the WatchPat 1. It's disposable. We show the patient how to use it. They go home. They sleep with it that night. They throw it away the next morning. The data is expressed up to the cloud. We get it. We have a diagnosis within 24 hours for the patient. And then once we diagnose, then we have treatment options. So it sounds really simple, and it really is, but there's a lot of factors to look at. But it's very simple to get your foot in the door and get started on your road to a healthy sleep. It's not that difficult.
Yeah. Now, one of the things that I know, because I do have a little bit of knowledge when it comes to sleep apnea, is the fact that a lot of the machines that are being used to treat them, the CPAP machines, do automatically register a lot of the information that would need to be registered. But when it comes to other conditions that are causing that are causing lack of sleep, do people kind of have to just kind of keep a record for themselves? Or are there ways for that to be automatically kept as well?
Yeah, that's a good question. My patients that don't have sleep apnea, we'll do a sleep test on them, and we'll see that their sleep pattern is not normal, but they don't have any apneic events. So we start looking at other things. That we start looking at their sleep hygiene, their nasal hygiene. We want them breathing through their nose when they're sleeping, and if they've got a deviated septum or if they've got infection, excess mucus, we work on that. We work on their sleep hygiene. We work on diet, exercise, those type of things. Then that can lead to a good night's healthy sleep. If they don't have a physical obstruction, then it's something else. And the physical obstruction usually is in the nasal passages, not down in the back of the throat where obstructive sleep apnea starts.
Right. Okay. Well, Doctor, we have just about hit the mark, but I do want to thank you very much for joining me on Indiana in the Morning to talk about this. It's been a pleasure, sir, and hope to talk to you again about this sometime.
It'll be my pleasure. Thank you.
Thank you again. All right, ladies and gentlemen, that was Dr. Hal Stewart joining us this morning on Indiana in the Morning to talk about some sleep problems, sleep health, and a wake-up call for retirees who may not be getting the proper sleep that they need. Our interviews are powered and presented by Marcus & Mack, a law firm representing injured people.